Hello, I'm Elliot Hack, Community Relations Associate here at Ida Culver House, Ravenna. Before we start today's presentation, I would like to share a little bit about our beautiful community. Ida Culver House, Ravenna is a premier retirement community located in the heart of Ravenna in Seattle, featuring warm and cozy apartments, 3 excellent meals provided daily, a rich calendar of life enrichment events and activities to keep our residents physically, mentally, and spiritually engaged, and many wonderful shops and delicious restaurants within a short walk. Residents are able to live here independently or with some assistance. We have a lovely cottage garden with a well-maintained walking path, blueberry bushes, and a community pea patch with raised garden beds. We had our 3rd vaccine clinic just last week, which has enabled us to restart our group activities, reopen our dining room for all 3 meals, and most importantly, to reconnect with one another in person. We do have some openings at our community. If you or a loved one are interested in learning more about our community relations team would be happy to answer questions or take you on a personal tour of the community by appointment. We look forward to meeting you in person. And now on to our main event. We are honored to host Emily Hilderman, who will be presenting on tips for staying mentally and physically healthy during COVID-19. Emily Hilderman is a board-certified adult nurse practitioner who provides primary care at the UW Neighborhood Northgate Clinic and in partnership with Era Living for on-site care at Aljoya Thornton Place. Dr. Hilderman's clinical interests include community-based healthcare, geriatric functional assessment, living well with chronic disease, palliative care, and preventative medicine. Thank you so much for joining us today, Emily.
Thank you, Elliot. I am very happy to be here. I really appreciate the invitation to join and talk with everyone today about what I've learned over the last year and just a little bit in terms of how to try to stay mentally and physically as healthy as we can despite everything going on with the pandemic. I did, as Elliot mentioned, work at UW Medicine at both the Northgate Clinic and here at Aljoya Thornton Place. So this is actually the beautiful scenes that you see behind me are our clinic here on site at Aljoya Thornton Place, where I was seeing patients this morning. So you get me straight from talking with people about exactly the sorts of things we're going to talk about today. So it looks like we have a nice group, and hopefully we'll be able to get some really good conversation at the end of the visit. In my slides, I do have numbers at the bottom right-hand corner. So if you have a specific question about something you see, you can reference on slide 13, you said XYZ, and I'll try to get right to the heart of that question. I do also want to just highlight I am a geriatric nurse practitioner, but I also work with everybody over 18. And so I see a wide range of patients and really have gotten to see from a broad perspective what people are going through during this pandemic. So if you'll give me just a second here, I'm going to pull up my PowerPoint presentation. So 2 seconds. This is the joy of Zoom as we all get onto the same page. All right, looks good. And so you guys should be seeing my PowerPoint now. Elliot's going to wave at me if that is not the case. Excellent. And I'm just going to rearrange my Zoom a little bit so that we can see this a little better.
Now, Emily, we do have a little black bar in the middle of the screen here.
Yeah, and that I tried to get rid of that, and it doesn't seem like it wants to go away. So what I'm trying to do right now is move all of these participants off the middle of my screen. Nope, that's okay. I'll just go through it. So joys of Zoom, everyone looks just a little bit differently. I do apologize about that little black bar at the top. I'm just going to pretend it's part of my slide. So,
Emily,
yes.
do you want to try sending the PowerPoint to Elliot and he can advance your slides for you if that's easier?
No, I think it'll be just as easy for me to go through as I'm ready for the next one. But thank you. All right. So I really, as I was saying, really appreciated the opportunity to talk about these things. It's something that I've talked about with so many patients and colleagues and family members. The COVID-19 pandemic is something that has affected all of us. And it's something that without being able to kind of process that, we really are at a deficit. And so I really enjoyed being able to reflect back across my year, look and kind of refresh my read into the research as far as what we've been learning as we go through this, and also to try to synthesize that and think about ways that we can put it together as a community to have some tips and some tools to help people be healthier overall. So these are some of the things that I have seen from my patients particularly, but also that we're seeing across the healthcare system in terms of how we're helping take care of people. So the first question I have is what is healthy? What makes you healthy? And I kind of challenge each of you to think about what comes to mind first. Is that having a blood pressure of 120/70 or a blood sugar that's exactly on track? Or is it something that has more to do with happiness or something that's in the line of prevention in terms of an apple a day, keeping the doctor away? Does that mean that you're healthy? So when I sat down and thought about it, I really found that there's three main components to our wellness and our healthiness. Of course, the physical side of things, which are looking at blood pressure, heart disease, all sorts of things that would be more concrete and physical components, but also your mental health and how are you coping with the stressors that come your way on a daily basis? Is there some underlying depression or anxiety? Is there something that is stressing from a family dynamic? And so, how does that interact with your physical health? And then, to that, we also can't escape our environment. We are all conditioned by and challenged by our environment. And particularly this year, there's a lot of things that we can't control. And for many of us, that's how we kind of define our spaces, what we can control. And there's so many things with this pandemic that we simply can't. So we are right there where those three things intersect. And it really is, you can't separate the three, but we can focus on each of them and see if we're able to get a little more definition. This picture is something that I've seen many different times, and it's come through, I'm sure many people have seen it on social media or in the news, that idea that we're all in the same storm, and that we're all dealing with this pandemic and the challenges that have come with it, which are huge. The loss of life, the suffering that people have experienced, challenges in financial senses, but also just how hard is this for everyone to process these changes. I have heard a lot of excellent commentary about we're in the same storm, but we're all in different boats. We have different challenges that we're already dealing with, different resources and supports that we bring to this storm, and how are we able to use those for resilience and to weather the storm. It is something that we can't always change our boat, but hopefully we can stop any holes in the bottom from leaking. All right. Now, Elliot, I do see, I was going to pull up the chat just real fast because we've got a nice small group. And so I was going to see if I can grab that, but no, I can't. So that's okay. I'm just going to keep going with what I've got, and Elliot will wave at me if there's something that I need to go back and clarify. So the storm, I think, is really aptly categorized by this graph, which is from King County Public Health. They have collected an incredible amount of data and information over the past year, past 13 months. And it really is, if you are a data person, this is a great place to go to. If you're not a data person, this can be a little bit overwhelming. And for some people, this is kind of that sum up and says you're looking at the peaks that we've seen, and then as we're coming back down, the hopefulness that we see in those change in numbers. It is something that you can very clearly see from January. So the top right graph there is looking at the progression of the numbers that we've seen in terms of positive cases. And we are starting to fall, especially with all the social distancing that's been done and the introduction of vaccines. So I actually find this slide hopeful, even though it is a little bit of a roller coaster in terms of all the information that's being presented. So in terms of kind of breaking it down a little bit more, this is one of my big go-to resources. And I think for anybody that is feeling overwhelmed or that is just kind of underwater from all the news that is out there and the constantly changing information, it has been one of our really big challenges as healthcare workers is to make sure that current and up-to-date and good information is getting to our patients consistently. There's so much information out there, and some of it is better quality than others. This is one site that I really trust, and it has links to excellent resources as well. So I was just going to bring this up real fast and show you a little bit of the resources that are available there. So this is the King County Public Health website, and it looks like it may be having just a little bit of trouble on my screen. Guys seeing that okay? So it breaks down.
No,
Elliot,
we're
you're
not
shaking your
able
head.
to see that, Emily, for some
Okay,
reason.
it's not coming up.
Mm-mm.
Okay, That's actually okay. All right, so I'll just tell you about it then, since it doesn't want to actually transition from our slideshow. So the Department of Health website has excellent information broken down into several different categories, particularly looking at what is our current status, what are some of the resources out there for people that are trying to get more information about prevention or about symptoms that they may be having. If somebody's trying to locate a testing location, I know that many people are seeing this possibly from places that aren't Seattle or King County, and all of the public health departments have very similar websites in terms of your local resources. This one is particular to King County, but that information is generalizable in terms of especially the prevention and testing information that is out there. If anybody is a veterinarian, I don't know if we have any veterinarians on the call, but they have information specific for you too. So there's just really excellent and reliable information here. So I broke this down into the three main categories, particularly looking at physical health, mental health, and then those environmental factors. It is something that the physical side is always kind of easier to look at. It's concrete, we can create data, we can measure how we're doing in that sense. So these are the categories that I find most helpful as far as thinking about physical health. And so I've broken each of those down into a little bit more description. Honestly, each of these we probably could do a 45-minute discussion of. We could easily spend hours talking about sleep or about the importance of physical activity or ways to support people living with memory loss. So I'm going to try really hard to keep on topic with it. And if we get to the end and have run out of time, we'll try to backtrack a little bit. So first and foremost, during a pandemic, I feel like if we're talking about being healthy during the COVID pandemic, number one thing is don't get COVID. So there's a lot of different strategies that people have been using over the last year to avoid that. Masking is one of the first steps that we put in place, as well as the social distancing. There have been updates from the CDC regarding masks, and should that be a single mask? Is that a cloth mask, surgical mask, double masking? It's hard to keep up on all that information. The most important piece is that you're consistently wearing a mask when you're around people that aren't part of your household and that it has a good seal. So checking as you're right around the borders of your mouth and your face, do you have kind of a gap in the fabric? Is it tight around your nose? Making sure that you've got a good seal. Hand washing, apparently people weren't washing their hands like we thought they were, because now people are doing a really good job. And we have seen a big change in infection overall. We've seen one of the lowest flu years that I have ever seen in terms of what we're seeing in primary care clinics. We're not as actively testing for flu symptoms, but I have to say I have seen one person that I would have tested for flu, which is shocking to me based on how many patients I saw even just last year that we were worried, was this influenza versus something else? So all of those pieces are hugely important for the hand washing, and then also thinking about who is it that's in your household? Who are those people that you are close enough to and are important in your life that you want to form a bubble with? Those are the people that you're around often enough that you don't wear your mask, or that you're in close enough proximity to that you're very careful about protecting them and they're protecting you from the coronavirus. So thinking about, is that somebody that you just go out to dinner with? They're then in your bubble. Is that a family member that comes to visit regularly? That is somebody who's in your bubble. So all of the strategies we're talking about today are trying to help that whole community or that bubble of people. Infection prevention is more than just the coronavirus. I was just talking about influenza and how it's been a very good year in terms of low numbers for that. It is something that we still really encourage everyone to make sure they've had their flu shot this year. We are coming to the end of flu season, but we still have flu shots available in clinics and at your pharmacy if you are one of the people who has not been able to do that yet. We also encourage everyone who's over 65 or anyone who has high-risk conditions like diabetes or lung disease to be up to date on their pneumonia vaccines. It is something that usually is a once or twice dose, depending on your health conditions. And so if you're up to date on that, it helps reduce the risk of our most common causes of pneumonia. And what we're aiming for with both of those, and why they're such an important piece during the COVID pandemic, is we want to prevent every reason that somebody might come to a point where they need to come into the healthcare setting. Where if you get really sick and you need to come into the hospital because you've got pneumonia, whether that's coronavirus or not, we want to try to prevent that illness and keep you out of the hospital.
Oh, Emily, we lost your sound. We're not able to hear you for some reason. Emily, we lost your sound. I don't hear you from my computer.
Emily, if you are able to hear us, can you pause so we can try to get your sound back? At present, we can't hear you at all. And so if we're not able to hear you, we may need to end the presentation and reschedule it for our attendees. Let's give her just a couple of minutes to see if we can get her sound back. Unfortunately, we're still not able to hear you. Don't we all just love technology? Do you want to perhaps try logging out and then logging back in?
Sorry, everyone, we are experiencing some technical difficulties right now.
Can you guys hear me now?
Yes, we hear you now.
Okay. Well, I'm not sure what that was, but I'm going to get rid of the headphones because they appear to have been working only temporarily. And I'm going to try to go back on this without having the black bar. Okay. My apologies, everyone, for these technical difficulties. Are you guys seeing my screen right now?
No, we don't see your screen.
Fortunately, it won't open the page to share. Okay.
Emily, would you like to try rescheduling possibly?
Yeah, it is. It seems like we're just having a lot of misconnections today.
It does seem like the technology just does not want to cooperate with us today.
No, it's pretty frozen up. Why don't I'm going to try logging out and coming back in and see if it's just a fresh connection.
And thank you for bearing with us, everyone.
If we are not able to get Emily back and make this a good experience for everyone, I think in the interest of everyone, we'll go ahead and reschedule this. So let's give her a quick try and then see how we go from there.
All right, Emily, we've made you co-host again.
Okay, can you hear me now?
Yep, we can hear you.
No. Okay, how about now? Can you hear me?
Yep.
Let's try this again. My apologies. And I'm going to try screen again. Okay, so you guys should see my computer screen at this point.
We do. Mhm.
I'm going to see if I can minimize the bar because I think that's what was in the middle. And okay, so I'm no longer able to see Elliot since I minimized that. So Elliot, if you need to send me a text if we're having more challenges there, please jump in that way.
Sure. And
Emily,
the black
it looks
bar is gone.
fantastic.
Oh, what was that?
It
The
looks
black
great.
bar is gone now.
It's gone? Okay. So we were just talking about, I apologize about that difficulty with technology. I think we are back online now. Let me know if you're not able to hear me. We were just talking about the different pieces of physical health and how we're working on those through the COVID pandemic. And we were looking at the vaccine. So it is something that Washington State is in the first 1B stage of vaccines, which is everyone over 65, also anyone over 50 that is living in a community home or in supported housing. So if you have family members that are helping take care of things at home, that also counts for those family members as caregivers. So if you're not sure, you can walk through the Phase Finder online. And if technology is not easy for you, as it clearly some days is not for all of us, there is a call line and a hotline that's there on the screen that you can use to call for assistance. The Department of Health and also King County Public Health both have excellent information in multiple languages. So if it's something you know, someone who English is not their first language and they're having trouble connecting, they can use those hotlines and say the language that they need, or they also can find their information online in their native language. There is fresh information from the CDC that is brand new and hot off the presses from yesterday. And it is very hopeful in terms of looking at people that are fully vaccinated and how we're going to be able to start opening up a little bit more in terms of who's part of that bubble. So it is something that we are thinking that people who are fully vaccinated, so if you've had either 2 doses of the Moderna or the Pfizer, or 1 dose of the Johnson & Johnson, 2 weeks after the last dose, you are able to gather with other fully vaccinated people in small group settings. So especially thinking about families or people that have been able to complete that in that 2 to 4 to 6 size gathering is something that you can start being together without masking. It is something that if you are around people that are not fully vaccinated, or that may be at very high risk or have someone in their bubble who is at very high risk, we still want to make sure that you're wearing masks and doing that distancing to help protect those other household members. And that is the big reason why, even though we're getting more and more people who are vaccinated, we want to make sure we're still protecting people who may have that really high risk of severe outcomes if they do get sick. And so unless it's somebody that you really know all of the people they're going to be in contact with, we still encourage wearing that well-fitted mask and physically distancing. I also wanted to look a little bit as we're talking about prevention at a standard wellness visit. Many people are familiar with this as your kind of annual physical. It is something that's a very specific benefit through Medicare and is something that is more of a functional assessment in terms of if we kind of assess everything for everyone of a generation in the population, are we able to catch things early? So asking things about how often are you exercising? Have you been able to see your dentist? Have you been able to do your mammograms and your colonoscopies and all of those pieces? So it's a really dedicated time to meet with your primary care provider to take a step back and make sure that we're staying ahead of things. It also is a good chance to check in on chronic conditions as far as blood pressure or diabetes. How are we doing with the status of those conditions? It is something that all of those challenges that we all have, the aches and pains or the conditions that just give us a little bit more to worry about, they didn't get any easier when we hit COVID-19, and being more difficult to get into the doctor's office, more difficult to get to a gym and do some of our exercise routines. All of those pieces made it more complicated for people to take care of their chronic conditions. It is something that on the flip side of that challenge, we have seen a huge influx in telehealth and remote care. So people that are able to follow up with their doctor without physically coming into the clinic. And it is something that all of our primary care systems, UW Medicine, I've had a great experience going through this as a provider and also as a patient. And I know all of our systems are doing this as well. It is very helpful for us, any data that you're able to get at home as far as what is your blood pressure, what have your blood sugar readings done if you're diabetic, checking your weight, so that we can really watch those trends that we normally would have gotten in clinic. We can still get that data from your collection at home. It is something that particularly for wellness visits, we can do those as telehealth appointments or even a phone visit if it is Medicare. If it's through standard insurance like Premera or Blue Cross and a more standard wellness visit, then we need to see you physically in person for that. I've had a lot of patients tell me that they've gained the COVID-19, similar to the freshman 15. And a lot of that is changes to eating to-go food more often or going for comfort food. So either eating too much, not being active enough, or not eating as good of quality foods. It is something that is a complicated situation, and I always encourage my patients to be gentle with themselves if they've gained a little bit of weight this year. It is a rough year, and if this is how you made it through, that's okay. Let's see what we can do to add in some more exercise or to look at eating more healthy in the future. I have had a number of patients, though, who have experienced weight loss, who have lost some interest since they're not eating with friends or eating with family. They've kind of lost some appetite, and so they're losing some weight, which is equally concerning. We want to watch that balance between how much you weigh and how tall you are in terms of your overall health picture. I always encourage patients, if they're working either on weight loss or weight gain, to think about what's the nutritional value that's in your food. Are you able to kind of see the different nutrients in terms of vitamins and minerals, or is it mostly kind of soft and processed food that's easy to eat? So not looking just at the calories. A Diet Coke doesn't have that many calories in it, but it also doesn't have as many nutrients as, say, applesauce. So it is important to kind of think about the quality of what you're eating as well. So as you're getting that apple a day to keep the doctor away, what's the quality of the food that you're getting? There has been also a lot of research, and I've had many patients ask me about vitamin D specifically. And it is something that especially earlier in the pandemic, so back last April and May, we were seeing a higher prevalence of patients in the hospital who were seriously ill with COVID that also had vitamin D deficiency. And so there was a flurry of research that happened at that point to see if either supplementing with vitamin D at that point could treat and help reduce the symptoms of COVID, or if being at a higher level beforehand was preventative for not getting severe symptoms with COVID. Unfortunately, as that research played out, turns out that the vitamin D was not the strong predictor in terms of preventing those big symptoms. And it is something that we do not recommend high dose vitamin D supplementation in terms of preventing COVID or treating COVID. It is something vitamin D is recommended in low doses for everyone to help with bone strength. And so it is something to make sure that you've got the right amount there. But we want to be careful that we're not pushing someone into a toxicity or too much vitamin D for your body to safely process. It is broken down by the liver, and we want to make sure that it's not interacting with other medications, particularly at high doses. So vitamin D is good in small doses, but not high doses for preventing COVID or treating COVID. So I'd like to do a quick posture check, and I can't see anybody except for Elliot, so he's going to have to be extra good. So I'd like you to take just a moment and think about, how are you sitting? Are you sitting there looking at your computer, kind of looking stressed like this guy is? Notice his back is kind of curved and he doesn't have very good posture. As I look at him, he looks like he's got back and neck pain to me. And I am seeing a lot of people for what I call Zoomitis or computeritis, for people that we kind of come forward into our computers as we're working on our computers or our smartphones. Everybody's spending a lot more time coming into forward flexion. So if everybody just takes a quick second and think about your posture, how's your back? How's your neck? Where are you looking? Do you look down or are you looking up? All of those pieces can have a big effect on back and neck pain, particularly if you're starting with back and neck pain. So if you already have some arthritis or some other changes from prior injuries, and now you're spending 8 hours a day coming forward, it really can make it very painful. I also like people to think about, how easy is it for you to take a deep breath? So as you're sitting right now, are you able to take a deep breath in and out? That's about the right posture for you. If you're able to easily breathe in and out, that exhale sets you in the right place for your posture. So thinking about looking up, having that nice deep breath, and making sure that you're having that good posture throughout your day. It also is something, especially with kind of being stuck at home, not being able to go out and see family or do things we normally would have, that sometimes we realize I haven't moved around much in the last 6 hours. And so having either reminder systems for yourself or ways that you're checking in with yourself, doing that quick posture check to say, have I moved? Have I checked my position? Am I having any painful hot spots, especially in your neck or your back or your shoulders are really common areas to get that. We do have a number of resources if you are somebody who's experiencing some of those pains, definitely working on your home routine. So having a trigger that every time you see a certain thing, you do a quick stretch and you reposition. So it is something that even every time I see the color blue, I do just a quick check, make my neck straight, and go from there. There's also lots of online trainings that are happening with everything moving from our regular in-person meetings to online. There's also a lot of YouTube and other excellent physical therapy type things that are available for free online. And so there are some great resources out there to do that. I always encourage people to take that with a grain of salt as far as any recommendations coming from something online, to make sure it's coming from a reputable source and that it's not pushing you into any pain. Especially if you have osteoporosis or prior injury, we don't want you starting a vigorous exercise program without checking in with your medical team first. If you do have a complex history, as many people do, physical therapy can be a great way to build a home exercise program and know that it's going to be safe and individualized for you. So that is something that your primary care provider often can do an assessment and determine if PT is a good match for you. We also have home health as one option. So there's physical therapy that is outpatient, where you come into the clinic or meet with the PT by telehealth. And then there's also home health, which is a separate benefit through Medicare or private insurance to have in-home services arranged. That is particularly designed for people that have
more complex health situations and aren't able to safely get into clinics. So it is a very specific referral that needs to be arranged by your primary care provider. It can include nursing, occupational therapy, speech therapy, and social work to really help people that are having trouble at home, that it's difficult for them to come in, but we want to try to prevent kind of the escalation of their health conditions to the point that they need something like a nursing home or something that's a higher level of care. So it's really that step between trying to help support you where you are. Sleep is a very common challenge that I'm hearing from patients and seeing in the research. It is something that a lot of us have lost our routines as we're staying up later watching television or doing other things, and then kind of pushing sleep later into the night for many people. Some people feel like it's hard to get out of bed and they're having trouble motivating for those changes just in their routines. It is something that really protecting that routine is incredibly important. So trying to set about the same time for your go to sleep and wake up routines, getting your exercise and that physical activity earlier in the day is key to then being tired and winding down at the end of the day. Screen time, so particularly cell phones or computers, can affect your REM sleep. And so if you're using those screens, especially right before bedtime, it can affect the quality of your sleep. I do encourage people that have trouble falling asleep, especially, to think about what are some relaxation routines that work for you, whether that's prayer or meditation. A lot of patients find progressive relaxation or yoga to be very effective in terms of helping the body and the mind to wind down and be ready for sleep. If it's something that you're just not able to fall asleep and you've been laying there for half an hour, we do encourage people to get up, do some of those calming activities, and then get a fresh start back into bed. You can get a vicious cycle of, I'm on sheep number 867 now and I'm still not asleep. Oh my gosh, I'm never going to sleep tonight. And it becomes a vicious cycle with some anxiety thrown in to make the insomnia extra fun. It is something that one of the chronic conditions that I work with really regularly, and that is one of the bigger challenges right now, is people that are living with memory loss or that have formal dementia. And these patients are many people that we know. We may be these patients that are worried about our memories. And it is something that in general, people with dementia are at higher risk for more severe COVID and COVID complications. A lot of that has to do with the difficulty they have in masking and keeping social distance because of disorientation, but also because of their high level of need in terms of person-to-person care. So it is something that if caregivers aren't able to really be consistent with masking or the distancing when they're providing that direct care, it really can be a complicated and dangerous situation. And this has really led to strict precautions in communities like ours at Era Living and around the community in terms of how do we help protect people through creating these social distancing, even though it is very difficult for the patients and families to go through. So there's a huge amount of research that's happening right now, looking at how we support people using technology, using safe interventions, and really support them through this pandemic. It is something that unfortunately, if somebody does get sick, a new environment of like the hospital or being moved can be incredibly confusing. And so it can be very challenging both for the patient and the care team. And it is something that there's incredible work being done right now by both families and the communities that support them. So I'm very proud to be part of that support network for patients. And so I have a lot of patients and their family caregivers that I work very closely with to make sure they have the resources that they need and to try to be as creative as we can about how do we help either keep people at home, or if they're living in a community like an Era Living building, assisted livings across the communities, how do we really make that the safest and most successful and still have good focus on quality of life. I'm kind of watching the clock and I want to make sure that we're really respecting your guys' time since we've had some technical difficulties today. So I'm going to brush a little more quickly over some of these resource slides, but I do want to highlight for the Alzheimer's Association, they are one of my go-tos for all family caregivers. A lot of their information can be generalized, whether you're helping a family member that has cancer or has heart disease or has dementia. A lot of their tips on how to help take care of yourself as a caregiver are very universal. And so they are an excellent source. Their call line is excellent in terms of, I'm a caregiver for my mom who has dementia and I need help with X, Y, and Z. And so that is an excellent number to be able to call. Sound Generations is similarly a resource clearinghouse, and they have a much broader view. So for caregivers in general, and also older adults who are trying to find more resources, they have a great collection of resources and very well-trained staff. If you call and say, I'm trying to figure out XYZ, they can say, here's the next resource to call. They also have an excellent website, especially if people are having trouble with food insecurity, knowing where that next set of meals is going to come from if it's hard to cook. Also, they coordinate a lot of the wellness programs in terms of enhanced fitness and other wellness exercise programs through the senior centers. They are one of our largest kind of community forces in terms of helping older adults particularly. Their phone number that I pulled in here, the 448-3110-206 number there, is that number that goes to their Pathways Information and Assistance. And so you can call them and say, I'm 78, I need to try to find some more help with my chore services. Where do I even start with that? And they can help you get that list narrowed down. They have all sorts of different things. They also coordinate some excellent caregiver support groups, all of which are meeting remotely right now. And so it's that excellent chance to really find more services, a lot of which have been made more accessible because of the pandemic. So instead of physically trying to get to a place on a Tuesday afternoon, you log into a Zoom meeting similar to this. Hopefully they have better luck with their sound than I did. All right, I've gotten a lot of questions from patients and families about advanced directives, which are a broad category of the choices that people can make, patients particularly, about end-of-life care. And it is something I try to talk about with all of my patients right now during their wellness visit, because it is something that the pandemic has brought into sharp relief that we don't know. And there can be such surprises in having those conversations with your family before you're at that moment of needing to make really serious decisions is incredibly important. And it takes the pressure off of families in really difficult times. So it is something I encourage families to talk about and think about, not just for older adults, but also for everyone. Because it is something, for example, if you're not married, do you know who would be the legal decision maker for you if you weren't able to speak for yourself? So I think really talking about those things, thinking about what is most important for you. Would you want to have CPR? Would you not want to have CPR? Would you want to try a feeding tube? Would you not want to try a feeding tube? Especially if you have really strong opinions and feelings about what you would want at end of life. And if they lean towards, I would not want this type of treatment, you need to tell us that and clearly so that we don't automatically do those things, because as a healthcare system, we will automatically do everything we can to help keep someone alive and help keep them going. But if you know that is, if your heart has stopped and you're no longer breathing, you don't want us to try anymore, you want us to let natural death progress, then we'll respect those choices. And that's very important for us to know that. So as far as advanced directives, there's more broad, here's the kind of things that I would want, here's the people who I would want to help make decisions. And then there's the more specific bright green form, which many people recognize, that's designed for people that have more complex health and have something that could be that event in the near future. It's not a specific, we think you've got 3 months, so here's your green form. It's more, there's a disease that could be something that causes your heart to stop. What do you want us to do if that happens? And so it's broken down into several sections, looking at CPR, yes or no, fairly straightforward, but a really important conversation to have. And then below that, it's more kind of guidance in terms of what type of care would you really want us to focus on? So is that something that you want us to try everything, bring you into the ICU, do all the treatments we can? Or would you like us to try to avoid the ICU if we can? So these are all conversations that need to happen with your doctor or somebody who can then authorize, we've gone through this conversation specific to this patient, and we agree that this is their goals for end-of-life care. And so it actually is essentially a prescription for paramedics or first responders to be able to not perform CPR. So especially especially if you know that you do not want us to try CPR. We need to have one of these forms on file, and it should be somewhere that's easily accessible for you. We're on to mental health. That seems like a big segue from talking about advanced directives, but it all goes together. It is something that as we're looking at mental health particularly, we know that there is so much grief that has happened this year, and there's so many losses that people have experienced. Both people that are sick and suffering, but also people that have lost jobs or that are stressed with transitions in childcare, grandparents that aren't able to see their grandkids the way that they had been. And all of those societal effects really add up to people. And especially if there has been some underlying mental health, either anxiety or depression before, it really amplifies that. And so I want to look just at a couple of factors that I think are really important to think about for you. All right. So these are the pieces, again, put together by King County Public Health. So that website that was right at the beginning has really easy to navigate portals that will take you to incredible data collection and graphs looking at unemployment, food security, food insecurity, healthcare stressors, people that are signed up for healthcare versus not. Also things like domestic violence and some of those things. I was pleased to see the traffic is down, which is improvement on the stress. So I think some of these things are also good. But it is something, however this graph or this kind of box is interacting for you, it is something that's your experience. And it's really important to kind of look at what are your stressors and what are your triggers and what can we do either as individuals or as care partners to try to help them a little bit more. It is something that family dynamics can be really complicated, and they don't get any easier when it's in a pandemic. So your experience really is the key there, and just because somebody else may be worse doesn't make yours any less important. So definitely want to make sure that we're looking at those problems and really asking, how are you? So I've got another exercise for everyone. If you want to think about the last 2 weeks in particular, how much have you been bothered by any of these following problems? So the options would be not at all, several days, more than half the days, and nearly every day. So I'm not going to read all of these. I'm just going to put them up as they come. So thinking about the last 2 weeks, how much have some of these been bothering you? Not at all. Several days, more than half the days. Everybody kind of think about this for yourself. So this is a tool that we use out of primary care and mental health clinics particularly, that's called the PHQ-9, and it is a standardized test that helps us screen particularly for depression. I basically give it to every single patient I see right now because everybody is experiencing some degree of stress or distress. And it also helps us capture a lot more of how that interacts with your daily functional ability. Are you having trouble falling asleep? That could be depression or it could be other problems. And so it's a really good just kind of status check of how are you doing. Particularly if somebody's really tired, that could tie into sleep, that could tie into nutrition, it could tie into underlying health conditions. So there's a lot that comes together on this, and it's a really good way for us to look at what are the biggest challenges for someone and how do we really target in on that. So if somebody scores a 3 on their sleep, but they're doing really well as far as interest and pleasure in doing things, we're going to focus on sleep first. And so that really gives us some tools to target in. I kind of compare this to checking blood pressure in terms of we've got that measure that's a kind of standardized status of what we're checking, and we can compare it over time to see how someone is doing, especially if somebody's working with counseling or they've got medications that are helping support mood challenges. It gives us a good measure back on how someone is doing. I think it is really important. Number 9 there is something that sometimes gets skipped over, but it is something that we are seeing increasing rates of suicidal thinking or suicide attempts in the public. A lot of it because of this isolation and the anxiety that people are feeling. So if it is something that you've experienced, distress at that level, we have lots of resources to support you out of primary care, out of the community health community. So we have all sorts of different ways to connect. So if you are feeling overwhelmed or you are feeling that you just don't know where to start in terms of what to worry about, reach out to family or friends. You don't have to say you're depressed. You can just say, I feel more down or I'm feeling isolated. Use the words that make the most sense to you. But reaching out to family and friends, letting them know what you're going through, building a lot of empathy there, because I think everybody can share some of those experiences. Your primary care and medical team is here to support that also. You don't need to schedule directly with a psychiatrist to talk about anxiety or depression. We talk about that every day in primary care. It's a huge part of your health and your wellness, and we're here to help problem solve how to make that better together. We're very lucky in the Seattle community. We've got great community supports. One of the ones that I recommend for all my patients that are weighing some of these challenges is the Crisis Connections, formerly known as the Crisis Clinic. They have an excellent website and a free 24-hour call line. You can see it right there. It's the 800-525-0127. And they are fully staffed with really well-trained confidential volunteers who are there to talk through any crisis. They also can help connect with other resources. And you don't have to be suicidal to reach out to them. It really is something that they're there to support our community any way that they can. All right, I am watching the clock here just a little bit, so we're really respecting your guys' time. Back to the King County Public Health. This is a great collection of mental health resources. It breaks it out by communities, by ethnicities, by age, and they've got great links to be able to talk to someone if you need to connect with someone right now, or if you want to connect with a counselor. They also have a great collection of volunteer opportunities. And so if you're looking for a way to get more involved in the community, it's a great way to make that connection. And so it is something that, again, that website, which is right there, and that I'm not going to try to switch to for the sake of our technical difficulties, is a great one to work through. And I find it really easy to navigate. I often will pull it up when a patient tells me they just don't know what to do next. I'll bring it up and we'll walk through it together so that we can find the one that's the right match for them. Alcohol and other substance use has increased dramatically during COVID. It is something that as people are staying home, sometimes that first glass of wine with dinner turns into 3 glasses of wine after dinner. And it's something that can be a slippery slope as far as, is it something that people are managing well, or is it increasing health concerns? Are they using it to treat depression or other anxiety? And is it something that could increase risk for falls particularly? So it is something, this is a website through the National Institutes of Health, which is a really excellent way to kind of walk through what is it that you enjoy about drinking, what are the risks that may be at the level that you're drinking, and making sure that you've got some resources as you walk through that about either getting treatment or pulling back on how much you're drinking. It is something that I think is incredibly important, and alcohol and other substances that help us to relax or to feel social. It's a way that we oftentimes engage with people, can be really important to talk about. Is it a healthy relationship with that alcohol? So, right. So as far as all of the things that we covered here, there's a ton of things that we touched on. There's no way that you can do all of these things and still kind of keep going forward with the day. So I really encourage people to think about one thing, kind of thinking back to that PHQ. Was there something that you answered, something that's bothering you more than half the days? Is it sleep? Is it appetite? Is it feeling really restless and having trouble relaxing? What was it for you that kind of flagged there? So thinking about those 3 categories, what has your blood pressure been? Is your weight staying stable? Thinking about one step that you want to focus on, and then following up from there. In terms of the environment, I think everyone is doing an amazing job in this community, helping us turn the tide on this and making it so that the COVID vaccines are able to get out to everyone and we're able to start being less socially distant. It is something that other current events also are a factor there. So people that are worried about climate justice or racial justice, taking action on some of those things can also have a big effect for your wellness. And so really thinking about what's one thing that you want to do for your next step. So again, you're right here and you can take a step any direction that you like. Some of the things that we found as far as kind of taking that next step is building some resilience and some things that help build in joy into your day. So learning something new as far as, I love this picture of the penguins when they went to the museum. They got to check out some artwork I can guarantee they have never seen before. But similarly, there's tons of museums, aquariums, zoos that have put everything online now because of the pandemic. And so there's great opportunity to learn about some of those things yourself. I encourage people to think about what are the things in your life that make you most joyful and how do you schedule something every day. It doesn't have to be big. You don't have to go to Paris every Tuesday. I wish we could, that's coming. But schedule something that brings you joy. Is it a favorite dish that you make? Is it a phone call with a friend? Is it something that is easy to do in your day and can make that big difference? Focusing on routines for sleep or nutrition or exercise. Again, picking one thing that you want to work on and working on that for a week or so and see how you feel. Doing some meal planning or working in some relaxing yoga in the beginning of the day can have a huge effect on how you're doing overall. And then finding ways to stay connected. So there's growing volunteer opportunities. A lot of those are remote. Especially using phone calls or other internet-based technologies, but people are really lonely. And so being able to reach out with them can make a huge difference. There's a lot of agencies in Seattle and around the state that are working on that. There is growing research on what's happening in terms of COVID response, mental health response, how are people doing in terms of their communities. The National Institutes of Health has a great series of research programs that they are doing looking at exactly those things, especially the behavioral health side of things. So if that is something that is interesting to you, that's a great way to give back to the community and also to be engaged yourself. All right, so this is that NIH that I was telling you about in terms of the ripple effects and all of those factors that are coming in during the pandemic. So there's a link there at the bottom. I'll put all of these links into a takeaway for you so you can print that once you have the quality handout with the PDF of the PowerPoint. It'll have all of these links. The big thing, if you only take a couple of things away from today's presentation, really thinking about a primary care provider that's your go-to. So somebody that can help you with both physical concerns and mental health concerns, not delaying that follow-up. I'm very concerned that we're going to see a wave of people as we're catching up on preventative care and catching things later than we would otherwise have if they've been able to get in to follow up on mammograms and things like that. So I've seen numbers of patients that they kind of put it off, I'll wait till I get my vaccine. And now unfortunately we're finding things sooner than we would have. So making sure that you're staying up to date on things with that primary care team is incredibly important. Sound Generations was that other resource that's the clearinghouse in terms of caregivers, community resources, transportation, food access, and then King County Public Health for all things COVID. Excellent up-to-date information, very evidence-based resources, and easy to navigate as well. So I really appreciate everybody joining us today. I apologize again about the technical difficulties, and I look forward to some questions.
All right, thank you, Emily. We really appreciate your time today, the wealth of information you shared with us. I know I certainly learned a few new things today. We didn't have any questions come in through the chat at all or through the email, so it doesn't look like we have any questions at this time. If you do have any questions, feel free to email them to me at elliot.hack@eraliving.com. That's ELLIOT.HAACK@eraliving.com. Any questions that I receive, I will forward on to Emily so she can answer them, and I will forward her answer back to you. So a little roundabout, but we'll get your answers, your questions answered no matter what. And thank you again so much for joining us today. Just a reminder that we'll be emailing out the slides from today's presentation, as well as a recording of the webinar when it's ready, and a link to an evaluation form. And we'd love to hear your feedback about this presentation and any other suggestions that you have for future Zoom presentations, both topics and also ways that we can improve the experience for future presentations. If you have any questions about Ida Culver House Ravenna or would like a tour, please call us at 206-523-7315. Again, I'm Elliot Hack, Community Relations Associate at Ida Culver House Ravenna, and this concludes today's presentation. Have a most wonderful rest of your day, and we look forward to seeing you again on future Zoom events until we can meet in person. Take care and thank you.
Take care, everyone. Thank you.